Howdy, y'all. My name is Brandon Vides, and I'm going to go over the recommendation report. For my introduction, burnout among nurses and staff has taken a toll on the medical industry. This could affect patients due to nurses and patients having a direct correlation with each other. Our studies to help the medical staff and improve the patient's experience. For my methods, analyzing the effect nurse burnout and stress has on a patient by analyzing the strength of correlation between nurses and patients and how impactful burnout has on a patient. We also conducted a set of interviews of regular people about their experience at the hospital to get a better understanding of the other side. For exploring the cause of burnout, we did this by conducting interviews with nurses at St. Joseph. For determining the most effective patient-to-nurse ratio, we had to look at secondary sources to find the sweet spot, due to many hospitals having different ways going through this topic. We inspected the benefits of volunteers for staff and patients by looking at secondary sources in other hospitals, but while also conducting interviews at St. Joseph to get a feel of what staff believes about volunteers and how much they benefit them. Compiling interviews with nurses about their experience with burnout and stress. We need this info to find solutions to an underlying problem and common issues. This was done by conducting interviews at St. Joseph's. For the results, fatigue and burnout often led to frequent mistakes. Effects of burnout and stress on patients, which negatively affect the patient and nurse themselves. Excessive workload and pressure for nurses led to an increase in medication errors compared to non-stress nurses. Noticeable patterns and reasons why staff deals with fatigue and stress. Patterns from interviews stem from feelings of being overworked and dealing with more than what they can handle, with some saying that work that outside of work also affects how their stress at work. The best nurse to patient ratio is 1 for every 4 patients. With 1 nurse for 6 to 8 patients having the worst strain on nurses due to leading to a 14 to 15 hour shift instead of the regular 12, leading to an increase of stress and workload. Huge advantage to having multiple volunteers at a hospital. Nurses say from the interviews they are useful and take some workload off their shoulders and help decrease costs. With volunteers at a hospital, increasing patient satisfaction. The most common symptom for staff stress stems from their workload. They say they feel overwhelmed and overworked from taking care of many patients and how difficult it is to handle multiple tasks with only one of them. For conclusions, the amount of workload is tied directly to a nurse's performance. That there is a limit in which they can withstand until being overworked. Number of patients is a direct factor to an increase of stress and burnout, thus increasing the chances of making mistakes and leading to a decrease in patient satisfaction. Workload decreases by adding more nurses or volunteers. Adding more volunteers is a cheap way to help decrease workload by increasing the volunteers. Limiting the number of patients per nurse can drastically decrease this workload. This stops the issue of the 12-hour shift bleeding into 14, 15-hour shifts. Recommendations: increase the amount of volunteers. No negative consequences to adding more volunteers to help the staff. They are cheap and not paid. Furthermore, they reduce the workload for staff, allowing nurses to focus on more important tasks and patients, thus allowing a positive patient experience. Decreasing the patient-to-nurse ratio. Having a one nurse for 4 patient ratio is the best option to prevent excessive workload, since it will minimize the stress and fatigue a nurse can handle. It also increases the quality nurse gives to an individual patient. However, this might lead to the need of more nurses depending on their number of patients. An increased cost, which may lead to an increased cost of more nurses, may be necessary. Thank you.